guys, welcome back to Simplified by Jinal Shah. Today we are going to do an interesting remedy, that is Aconite. Aconite is a very common remedy, mostly covered in first year itself. And it's one of the first remedies that we do in materia, so hopefully you should know it well. If you haven't followed me, you can follow me on Instagram. My ID is simplify.ed. The method which we are going to follow here is take a diagnosis and then see how the remedy fits in that diagnosis. Here the diagnosis is panic attacks. The general awareness about panic attacks, I assume, is great. Either you know somebody suffering, or you've read it well, or for some reason you might have had to go through it. But of course, Aconite is not a direct prescription for panic attacks, but if you know the pathophysiology and signs and symptoms of panic attacks, for you to understand Aconite, it is going to be much easier. So the first thing is that there are usually triggers for any psychological issue or complaints, or there could be no trigger as well. The triggers could be rational or irrational. Here, usually in Aconite, the triggers that we talk about is evening, night. Then there is dry cold air, or what they say is northwest winds. Now you might be asking me that whether the wind quality also could trigger panic attacks. Well, these are the characteristic symptoms which define the drug and not the illness. Okay. Then there could be another fears. There are fears in Aconite which could be similar to Argentum, which is fear to go out, again to talk to people, to engage into conversation in crowds. So now with these you can understand why I have chosen this as an illness. So the patient has, or the person has, some sort of fears which could trigger his actions and reactions. Then secondly, these triggers lead to certain manifestations which are great fear and anxiety. Now, what defines Aconite as Aconite, which we've always studied, is the clock phenomena. The person knows he's going to die, and he knows the time he'll die. He can predict the time. So this is strong sense of paranoia with fear and anxiety, where you think that the cure is just not possible. You're going to die, and you might get a bit restless and run for medicines here and there, like help me, so to get any relief. This feeling, when there is great paranoia, like I said, could give rise to restlessness. Okay, so the restlessness here in Aconite is mentioned as mental plus physical. So mental restlessness is coming from here. Physical restlessness, when we talk about that, it is that the patient has to continuously move, change position if in bed, or continuously walk about. We see restlessness also in arsenic and rust ox. Rust ox, it is mainly physical. So when we say only physical, that means the patient just continuously walks about because he is restless and anxious. In arsenic, it is usually only mental, because the person otherwise is way too prostrated to carry out any movements. Whereas in Aconite, the person has both mental as well as physical restlessness. You'll see him walking about, he cannot remain in the same position, and mentally his thoughts are continuous. What another thing we see in panic attacks is sometimes breathing difficulties or dyspnea. And something of like giddiness, which is also seen in Aconite, might not be attributed to the anxiety and fear, but for remembering purpose we'll include it there. When we say giddiness, it is more like when the person gets up, he feels extremely giddy, but then when he's lying down, he feels better. Again, if we have to correlate it with medicine, we could call it as orthostatic hypotension, right? Where the person feels giddy, as soon as he rests his head back to the ground, he's fine. Okay, so this is again a type of orthostatic hypotension. Breathlessness could be temporary. Again, in textbooks we go mention because of dry cold northwest winds, or any RS complaint for that matter is aggravated with northwest dry cold winds. All right. Another thing which we usually offer as a help to such patients, or any patients we don't know what to do, is water. Right, if somebody is panicking, you do not know how to console, you generally just calm them down, let them have their space, make sure they are comfortable breathing well, and then you offer them water. The drug in itself has unquenchable thirst for large quantity of cold water, right? A right, so this is about the water. Another thing about panic attack is that it is usually a sudden attack and has a remission. When we talk about depression, it is usually chronic, but with panic attack there is a duration, like say 5, 10, 15 minutes. So there isn't a sudden attack, but it also is followed by remission. It could be periodical, there could be repeated attacks as well. Okay, here with giddiness, what we could also add on is that there is deadly pale. The person becomes deadly pale on rising. So in diagram 1, he becomes deadly pale on rising. He becomes faint and giddy and falls, like we've seen in the picture 2, and he fears to rise again because it's like the body knows, right? It needs rest, it needs to lie down, the head needs circulation more at the moment, so the person fears to rise again. Now, one thing, if you've seen somebody get a panic attack, is they also sweat a lot. Like either the face is fully covered with sweat. That is all just parasympathetic responses. But here we see there is absence of sweat. So this is a negative symptom, no sweat. Let me again remind you that taking panic attack as a center is only for us to remember the symptoms. Aconite is not reduced to panic attacks, and panic attack is not the specialty of Aconite. Any disease that would have these symptoms. Alright, now let us talk more about fright and anxiety and what it could lead to. We know in homeopathy, whenever we have a very characteristic mental symptoms, physical symptoms arising out of it could be dealt, even if it is not part of the drug. What we do have is amenorrhea after fright, in young girls. Okay, then we have convulsions or epilepsy. This is again, it could be because of fright, like fright could be one of the reason. Second thing which they've mentioned is in teething children. Okay, so first thing is teething children might have convulsions, and then amenorrhea in young girls. Now what would be characteristic of this? Suppose this is a teething child. The child will, there's obviously going to be jerking and twitching, but the characteristic, it is of single muscle, it is not all over the body. Child gnaws its fist frets and screams. So there is going to be screaming, right? Frets, fist grabbing. All right. So this is about the convulsions of aconite. What we also have to understand is that aconite is an excellent remedy for pain. I forgot to mention it. Okay, so the pain in aconite is again going to be associated with fear that he is going to die, he will die. The pain is unbearable and it is associated with numbness. The reason to mention it at last is that it is a CNS symptom which also helps us to identify convulsions. So there is pain which is associated with numbness. So any pain, okay, like this could be a general symptom. Suppose the patient has toothache. The toothache is aggravated with dry cold wind, evening and night. When there is pain, there is extreme pain with restlessness, mental as well as physical. The patient will feel great fear and anxiety. He thinks he will die out of pain. He will run to a doctor to get the treatment. So that is how you figure out aconite and write each answers based on those common general symptoms. Now it is also good RS remedy. We have to check out spongia after this video because spongia and aconite are somewhat related. If I had to add on a few points for RS of aconite, it would be like it has cough. The cough could be dry, it could be croupy, hoarse, suffocative, because of course if we are going to relate it with this, it has to be suffocative. It is suffocative, it is loud, it is rough, there is whistling on expiration. So again, when I say whistling on expiration, these are old notes. When medicine wasn't that developed, we could say asthma, right? If there is wheezing or whistling on expiration. Asthma, which we also know could be triggered by, that's right, fright. So again, you get one more illness, a person with asthma landing up asthma after exposure to northwest wind, a very sudden attack with remissions. But if he's in the attack, he is scared, he's going to die, he's feeling suffocative. Why not prescribe aconite? I mean, we have restricted the prescription of aconites to only as a mental symptom with anxiety and fear, but if you see thoroughly, there are a lot of places where aconite could be a great prescription. One prescription where I have made aconite and it has helped is to a patient before surgery. So it was an eye laser treatment. The patient was extremely scared because of course it is painful. The general sensitivity of the patient to pain was high, but the surgery in itself is slightly painful. The patient was extremely scared and he did not want to take the treatment because he feared he's going to die. And to that person, I had given aconite 1 dose before the surgery, and he did well. He could sustain it. Alright, so this is aconite for you people. I hope you've understood it well, and please follow me on Instagram and subscribe to the channel if you haven't already to check out more such videos. Yeah, that's it.